Well, hi everyone, this is Dr. Schroder with this week's video introduction to week number 3 of our course in evidence-based practice. And I apologize for this being a little bit late this week. I had some internet connectivity issues this week and I couldn't get into YouTube. And so hopefully today I'll be able to get this posted and give you a little bit of guidance on what we've got coming up. Just very quickly, a review of week number 2. The primary task, you had 2 assignments. One was the library paper, where you were to write a paper addressing how you would do a literature search using the professional databases and identifying the Boolean strategies that you would use. Now, it's important when we're doing research for evidence-based practice, we should always be going to the research databases. And for this in nursing, that usually means using CINAHL, the Cumulative Index of Allied Nursing Literature, and that is found in EBSCO. So if you have, if you're in the library and if you can access EBSCOhost or Academic Search Premier, it is also called. That includes CINAHL, and the CINAHL includes virtually every nursing research, every nursing journal, every nursing article. But you have to know how to put the keywords together to really find that information. So that was the point of watching the video this week and having you write a paper to kind of come up with a strategy of how you would find information related to your PICO question. For your week 3, you're going to be doing an assignment that is essentially a 2-part assignment. The first part is what you're going to be doing in week 3. Is you're going to be doing a evidence-based practice appraisal, and essentially think of the appraisal almost being like a proposal. Think that you're going to be writing and arguing why you should be implementing this new intervention that you've identified, this new evidence-based practice. And refer back to your PICO statement from week number 1. Remember, a PICO is always a problem, a PICO addresses a nursing problem, but it's always a population, your proposed new practice intervention, a comparison intervention that you're going to use to compare to see if that intervention was actually effective, an outcome to measure the effectiveness, and a time frame, which is the time frame, how long are you going to be looking at your data before you look back and say, was this really a good new policy that we came up with, or a new intervention? Did it really work? The outcome is important because you're going to be looking at either an increase in something or a decrease in something. In other words, care should get better. You're going to see a decrease in infection rate or an increase in patient satisfaction. It's not just what is the effect, what is going to happen if we do this particular study. This isn't the same thing as a nursing research study, although it does have this many common aspects of a nursing study. The idea is that we've looked at the research. The research tells us that if, for example, nurses wash their hands more, and if they wash their hands after touching patients, and if they have a new hand washing protocol, we should see a decrease in hospital-based infections when compared with nurses that only wash their hands at the beginning of the shift, for example. So that's a very, very simple example, but that's kind of how the PICO is formulated. And then the time frame is how long are you going to be looking at that new process. Usually it's anywhere from 3 months up to about a year, depending on what it is that you're exactly looking at. So that's, again, I want you to go back and review your PICO because that really becomes the foundation of this paper. From the PICO, then you're going to identify and find literature. You're going to find articles related to that PICO question, and you're going to include them in your table of evidence. Now, I've had some questions on the table of evidence. I actually posted today an example that you can use. So there is a sample table that I have pasted that has the correct headings on it that gives you a little bit of an example of how the table should be formatted. When you're doing a table in Word, you do not have to keep it at 12-point font. You can use a smaller font to get all the information to fit into those little boxes. That's perfectly fine with the APA. That's one of those exceptions where you don't have to use 12-point font. You definitely don't want to double space. Single space, smaller font, to make it make all of the, as long as those columns are readable, it should be fine. And again, I've got that sample table posted in the Ask the Instructor forum. And in the paper, it's a 2,500 to 3,000 word paper, so it's a fairly long paper. Remember, this is a writing class as well. So you're going to be graded on your writing as well as your content. And you're going to talk about the background and the evidence-based question. Why is this a problem? Why did you select it? And what is the PICO that you've developed? You're going to do a search of the databases, and you're going to report on which of your databases were actually reviewed, or which ones what did you look at to find information? What were the keywords that you used? What were the keyword exclusions that you used? And how many files did you find, or how many articles were located? And then once you've located the best articles, you're going to pick the 5 best pieces of evidence that you have related to that evidence-based practice question, and you're going to complete the table of evidence matrix. We also call it a TOE sometimes, or the TOE matrix. And you're going to identify what kind of research was it? Was it a systematic review and meta-analysis? Was it a quantitative study, a qualitative study? There's 7 different levels of evidence, and I have some information, of course, explained in the text and explained in the course materials. And you're going to identify what level of research evidence is that particular articles that you're looking at. Then you're going to take the appraisal tools, one of the appraisal tools. Now I've included copies of the appraisal tools also in an announcement of the class, so you don't have to worry about creating your own template. It's just a type into template that you will use to appraise that evidence for each of those 5 articles. And then at the end of after the appraisal, you just write a conclusion. What were your findings? Again, going back to your introduction, kind of wrapping up, state how you met your paper purpose, and that then forms the basis of your evidence appraisal. Next week, in week 4, we're going to be discussing implementation. So you're going to be taking that same information from the work that you did this week and then applying it to how are you actually going to implement this in the hospital. It's kind of that's why I say it's a 2-step process. Same evidence, the same intervention. You're just going to talk about how you're going to actually make it work in the hospital. And so that basically wraps up. Oh, and this week for the discussion question, this week is going to talk about evidence-based appraisal, the AGREE tool and appraising clinical practice guidelines. Clinical practice guidelines are another part and another important aspect of evidence-based practice. And we all use them. All the hospitals that you work in, everybody uses clinical practice guidelines. They're essentially the guides that we currently use to guide our practice. What are the guidelines that are out there? The professional nursing organizations have all stated what their guidelines are. The American Nursing Association has their guidelines. And there's guidelines for both medical and nursing clinical practice. So we're going to be talking about that a little bit in the discussion questions this week. But primarily the big assignment this week, the big thing you have on your plate is that evidence-based practice appraisal paper. As always, as you have any questions, please let me know. I'm here to answer them for you. And just end us in prayer and say, Dear Lord, thanks for getting us through this part of the class, getting us through all the hoops that we jumped through. Continue to be with us, Lord. Help us to find evidence of you in our lives. May other people look at our lives and see that there is evidence of your heart, of your love, within all that we do. I pray that you be with us this week. Keep us strong, keep us healthy, and keep us in balance. As we pray in your name, Lord, amen. And amen. And with that, I shall leave you to the discussions, leave you to the assignments. Let me know if you have any questions, and I look forward to seeing you in class.